talk us through perhaps the process of, receiving a call from the police requiring that kind of sort of what's considered perhaps an unconventional form of backup in these mental health nurses. What is their skill set? What do they bring to allay a situation?
Well, what typically might be the case, the police have certain powers that within the Mental Health Act that enables them to effectively detain somebody who they feel is suffering an acute mental health episode, and if the police have got concerns about the risk they may pose to themselves, or indeed others, but typically themselves, then they've got the powers to remove them and take them to what's called a place of safety. And the places of safety are established in law, and on the Isle of Man, as is typical in the UK, they can be the police station itself, they can be the emergency department at the hospital, or they can be within the Manannan Court inpatient area. And whilst police receive some basic training around mental health, they're not mental health professionals. So if they come across somebody in the street, or they're as part of their normal duties, and they've got concerns, then they've got very little options open to them, other than if they're that concerned about an individual, other than to use their powers. One of the major points of this pilot is enabling the police to have prompter, quicker access to specialist mental health nurses, so they can attend, accompany an officer out onto the scene and make a judgment then and there, and assess the individual to ascertain what's going to be the best form of treatment, and importantly, that then can remove the need for them to be taken to the emergency department or other inappropriate areas such as the police station.
On a daily basis on the Isle of Man, can you give us an idea or give us a picture, perhaps a percentage of how many call-outs, how many people you are dealing with?
Within the police mental health liaison, or in the wider mental health service? So.
Let's say, generally speaking then, what's the scale of the police dealing with mental health incidents? Well,
I think the most recent, or certainly the 16-17 reports from the Chief Constable refer to 1 in 5 of their contacts having some sort of mental health component to it. Now that's quite an ambiguous term, but there's no doubt that the police do have a significant contact with people with both mental health and drug and alcohol problems. And those statistics, those numbers, are, as I said previously, are similar to what we see across the water. So typically, I think 1 in 5 was the number quoted, and we see, through our own sort of data capture, and the monitoring the police's use of the Section 132, which is the power they've got that I alluded to previously. It's a frequently used power, so they use it often, necessarily, and the intervention, the mental health police liaison service aims to intervene earlier. So potentially it would restrict the use of Section 132.
Using that 132, then, that mental health act, and detaining someone, you referred to before about the places where people would be sectioned, so to speak. Bringing people to a police station, is that an adequate course of action, do you think?
It happens extremely infrequently. People taken to a police station because there's concerns about their mental health. The only time you do that if someone was so their behaviour was so unpredictable, or there was a significant aggression, that would be, the police station would be used, and it's I think it's typically used a couple of times a year. So it's very, very unusual for that to happen. what the I've lost my train of thought again. Sorry.
If you've mentioned 1 in 5
Yeah.
before, having 2 nurses as a part of a pilot project, how proportionate do you think that is?
It is pilots. We're basically gathering the data to ascertain the need as we speak. So whilst they are operational and they are out there seeing people, and they're covering 12 hours a day, 7 days a week at the moment. Part as in addition to their operational responsibilities, we're gathering the data to inform the need. From what we can see thus far, we are going to be needing an additional member of the staff to make the service more robust, so to counter for periods of annual leave and training that's going to be required.
And where would that person come from? Would they come from the health service?
They would come from the health service, yeah. We'd be advertising for an additional member of the staff to join that team. And that will give us greater scope, like I said, to cover the service 7 days a week. And we're looking at changing the operational hours potentially based on the data that we're getting back. So we're covering later into the evening or potentially the early hours of the morning.
I know it's quite a generalisation, but obviously the NHS is under a bit of stress at the moment. Perhaps that's an understatement. But to take from the health service and bring to the police, is that a right course of action, do you think?
Well, it's we certainly don't see it as taking robbing Peter to pay Paul. This is very much about working together, and the 2015 and 2020 mental health wellbeing strategy really laid out that mental health is everybody's responsibility. We're not going to solve the island's mental health problems through one agency. It's a variety of agencies and the public and the third sector and different departments working collaboratively together to help and support people. So really, this very much embodies that sense of working in a kind of integrated way within departments to best serve the people of the Isle of Man, particularly those individuals who are vulnerable because of their mental health difficulties.
And what do you think about what police officers are currently equipped with? Because I know the Chief Constable, Gary Roberts, mentioned about redefining the role of a police officer. Just a suggestion, perhaps, that a police officer may become like this community officer that has this sort of broad spectrum of skill sets. What's in place for a police officer now, or as a 21st century police officer, to deal with people in crisis and deal with mental health issues?
There's no doubt that the training that the police have in terms of mental health is relatively limited, and we as a department, certainly the mental health service, are working very closely with the police to try and provide them, give them some additional skills and upskill them. That said, the purpose and focus of their role in society is very different from ours as a mental health service. So by no means are we looking for the mental health for the police to undertake our role. We recognise absolutely this is our role, but by embedding our nursing staff in areas where we know there's the potential for high levels of activity, it's really targeting those areas to ensure that we see the people in a timely manner and see people. And it basically affords the police the opportunity of not pursuing a mental health section route, if at all possible. And being detained under the Mental Health Act.
Some people might feel like criminals.
Well, absolutely, and I think it's again that's why having nursing staff working with police and being there on the scene to assess them, are clearly identified and visible as nursing staff, really wants to reduce that stigma and minimise that stigma, because there's still a significant stigma, although that's eroding, thank goodness. But there's still a stigma associated with mental health.
And how have the nurses found it? Obviously, it's the first of its kind, I suppose, for the Constabulary and the Department of Health and Social Care to have this joint collaborative sort of bridging operation. What's the feedback been like from them?
We've been working very closely with the police for a number of years, and my background is, as you can probably tell from my accent, is in South East London, and I've said this repeatedly since I've not worked in an area where there's been a better collaborative relationship between the police and mental health. I think it's excellent on the island, and there's real opportunities to develop our services to really give the best outcomes for the people of the Isle of Man. So this has been, there's been work going on for many years, and I think it's really gained momentum. Certainly in the last few years with the work of our director Angela Murray and the Chief Constable Gary Roberts, recognising that there's a gap potentially in services and filling that gap, and to enable us to meet the needs of those people who are experiencing mental health problems.
And for the nurses responding perhaps to crises, it must be a different environment for them, perhaps going from, I don't know if their background's in support or social work, perhaps sitting down and having a cup of tea with someone who's having anxiety trouble, to perhaps dealing with someone who's potentially wanting to take their own life.
Well, but both the nurses who are currently working with the police are senior nurses. They're both extremely experienced, and they'd be well versed in working with people who are in crisis. So the only change is the setting, really. But certainly speaking to them, which I do on a regular basis, I line manage them, and they speak genuinely passionately about the role they're doing and seeing the difference that it's making, and that's been echoed, certainly echoed by our colleagues in the Constabulary as well. And in addition to the operational, getting out there, seeing people both in their own homes or on the street, or indeed on occasion in police custody. So in addition to the basic operational functions of the team, just as working together, the police are gaining a greater appreciation about our role in the mental health service, and we're gaining a greater understanding of their role and their limitations. So we're learning from each other, which is inherently positive.
And what are you finding to be perhaps a trend amongst certain incidents of mental health? What kind of issues are you finding yourself up against?
Well, in terms of this project, it's very early days. It's still very much in its kind of embryonic stages. So we're looking at what themes and patterns are emerging, and we'll be targeting our resources and our approaches to meet those. So it's very early days to give any sort of definitive outcomes, but we're certainly we're certainly measuring that on a regular basis.
And you mentioned, you had sort of high praise for like the kind of third sector collaboration with the Department of Health and Social Care, as well as the Constabulary and this pilot project. How valuable is this insurance, so to speak, of having third sector? Because there was a time where the police, I think only a few months ago, we had a particularly busy weekend for mental health issues, and effectively said, call the Samaritans if you're in trouble. What is it like is that testament to something? Is that testament to a lack of provision, or is that testament to this multi-agency approach that we have?
Well, the mental health service works utilises what's called a stepped care approach. So there's a variety of different services and different pathways depending on the acuity, depending on how how urgent the response, how challenging the condition. So the access to the Samaritans, access to our colleagues in Motivate, access to housing matters, and that's not exclusive. There's a great range of them. Is incredibly important. And we, like I said before, we're not going to overcome or better meet the needs of people in isolation as a mental health service. We are reliant on other departments. We're reliant on the third sector to manage people's mental health problems and promote recovery for people with experiencing mental health problems. So it's not going to be solved in isolation.
And looking ahead now to the Christmas period and into New Year, I think traditionally quite associated with incidents of mental health. You're expecting a busy period, and perhaps are you better prepared now with these mental health nurses? Is this something that can help allay what is traditionally associated with these kind of incidents?
I think Christmas it can be it's a wonderful time of year, and it's full of festivities, but it can also be an incredibly difficult and challenging time for people. So yeah, we do anticipate that there's going to be more demand on our services, but the focus, the genuine focus of this current initiative, this pilot project, is for us to see people quicker, to see people and assess people in a timely manner, and make sure that we treat them as quickly and as efficiently and as effectively as possible.